Hello, I welcome you all to TMF. I am Dr. Rajat Swami. In today's lecture, we will discuss about penicillin. As we discussed in first lecture on antibiotic, penicillin act by inhibition of enzyme transpeptidase and prevent cross-linking of bacterial cell wall. Penicillin is beta-lactam group of antibiotic which contain beta-lactam ring. These are alkyl group. Penicillin G is first naturally occurring penicillin which is given as IV injection. Penicillin V is developed as oral form of penicillin. Both of these molecules are moderately heavy. These penicillin G and V are able to cross porous peptidoglycan of gram-positive bacteria. But cell wall of gram-negative is relatively impermeable to penicillin G and V. Permeability in gram-negative bacteria is depend on size of porine molecule. And this penicillin G and V only able to cross few gram-negative cocci because gram-negative cocci have large porins and spirochete which allow passage of this moderately heavy molecule of penicillin G and V. But porous peptidoglycan allow entry of this moderately heavy molecule. So penicillin G and V cover most of gram-positive cocci and gram-positive bacilli. Penicillin G and V also act against spirochete, that is Treponema pallidum, Borrelia, and Leptospira. Penicillin G and V constitute narrow spectrum of antibiotic. Apart from narrow spectrum, penicillin G and V have lot of other limitations, which include short duration of action, breakdown of penicillin molecule by stomach acid, and development of resistance due to beta-lactamase. Beta-lactamase is chemical which is produced by bacteria. This enzyme destroys beta-lactam ring of beta-lactam antibiotic. So these antibiotics do not work against organisms which produce beta-lactamase enzyme. To overcome this limitation, various penicillin have been synthesized. Penicillin V is acid-resistant form of penicillin. To make penicillin long-acting, penicillin is complexed with benzathine and procaine, resulting in formation of benzathine penicillin and procaine penicillin. Benzathine penicillin is longest acting penicillin. One of limitation of penicillin is short duration of action due to its excretion in kidney by tubular secretion, which is accomplished by action of organic ion pump. 99% of penicillin are secreted by this organic pump into renal tubule. To overcome this condition, we give penicillin along with probenecid. This probenecid saturates this organic pump, resulting in decreased tubular secretion of penicillin and increased duration of action. Penicillin G is drug of choice for syphilis. It is given as single dose of 2.4 million unit in case of primary, secondary and early latent syphilis, and given as weekly dose in case of late latent and tertiary syphilis for 3 weeks. Aqueous form of penicillin G is given in case of neurosyphilis. As we discussed, penicillin G and V are narrow spectrum penicillin. To overcome narrow spectrum of penicillin, new penicillin with extended spectrum have been developed. So penicillin constitute narrow spectrum antibiotic, which are penicillin G and penicillin V, and wide spectrum antibiotic. Penicillin also contain very narrow spectrum group of antibiotic, and these antibiotics act only against Staphylococcus aureus. That's why also known as anti-staphylococcal antibiotic. As we know, molecule of penicillin contain beta-lactam ring, which is vulnerable to attack by beta-lactamase or penicillinase enzyme. When we increase R group length, now this beta-lactam ring is protected from the attack of penicillinase enzyme. But addition of extra R group, increased length of side chain, further increase molecular weight of already heavy penicillin molecule. That's why this heavy modified penicillin molecule now unable to cross peptidoglycan cell wall of many bacteria. But peptidoglycan of Staph aureus is very porous and allow entry of this modified penicillin molecule into cell wall, where this modified penicillin molecule attached to penicillin binding protein, which is transpeptidase, and inhibit formation of new cell wall. Again, due to increased size, this newly modified penicillin molecule is unable to cross porine channel of gram-negative bacteria. So do not act against gram-negative organism. So what is this modified penicillin molecule? Well, it is methicillin, and its derivative can be remembered as commando. C stands for cloxacillin, O stands for oxacillin, M stands for methicillin, N stands for nephcillin, and D stands for dicloxacillin. These all antibiotics act only against Staphylococcus aureus. Methicillin is lab antibiotic which is used to check sensitivity pattern. It is withdrawn from market due to increased incidence of interstitial nephritis. Nephcillin is used clinically and side effects are neutropenia and nephritis. Oxa, cloxa and dicloxa are oral anti-staphylococcal antibiotic. Kindly pay attention since beta-lactam ring is protected by this side chain. We do not require beta-lactamase inhibitor along with commando group of antibiotic. So beta-lactamase do not act against this antibiotic. Staphylococcus aureus developed resistance against methicillin by altering its penicillin binding site. So there is decreased efficiency of binding of penicillin to transpeptidase enzyme, which ultimately result in decreased inhibition of transpeptidase enzyme. And this resistant strain of Staphylococcus aureus is known as methicillin resistant Staphylococcus aureus. Since all beta-lactam antibiotic act by binding to transpeptidase enzyme, so any beta-lactam which includes cephalosporin, carbapenem, extended spectrum penicillin do not act against MRSA. In MRSA, there is need to give antibiotic which act on the site which is different from transpeptidase. For example, transglycosylase, protein synthesis inhibitor like linezolid and streptogramins, and latest antibiotic which is levonorepinephrine, popularly known as Amroc. Transglycosylase is inhibited by vancomycin. Use of vancomycin is common in treatment of MRSA. Staphylococcus again develop resistance to vancomycin by altering penicillin binding protein site, and this resistant Staphylococcus now known as VRSA. Treatment of VRSA include daptomycin, linezolid, Amroc, and streptogramins. So again, penicillin group contain narrow spectrum antibiotic, penicillin G and V, very narrow spectrum group of antibiotic, commando. Now we want to extend spectrum of penicillin. So we cut the side chain of penicillin and make penicillin molecule light. Now this penicillin molecule can cross cell wall of all gram-positive organism and can cross porine of many gram-negative bacilli, which include ship organism. That is Salmonella, Haemophilus influenzae, E. coli, Proteus, and Enterococci. Example of this antibiotic is amoxicillin and ampicillin. Since we have cut the side chain to form amoxicillin and ampicillin, now beta-lactam ring is more vulnerable to attack by beta-lactamase enzyme. So we provide protection of helmet to amoxicillin and ampicillin, and this helmet is known as beta-lactamase inhibitor. Example are clavulanic acid, sulbactam, and tazobactam. This molecule inhibit beta-lactamase enzyme and prevent destruction of beta-lactam ring of amoxicillin and ampicillin. Amoxicillin is given with clavulanic acid, and this combination is known as augmentin, and ampicillin is given with sulbactam. Combination of ampicillin with sulbactam is available in form of unacin. Amoxicillin and ampicillin are wide-spectrum antibiotic which are effective against gram-positive cocci including streptococci or pneumococci and enterococci. Ampicillin sulbactam is drug of choice for listeria meningitis and UTI caused by Enterococcus faecalis. Foreign molecule of Pseudomonas and other ESBL producing organisms are so small that they do not allow entry of ampicillin and amoxicillin. So ampicillin and amoxicillin are not effective against Pseudomonas and ESBL producing organism. So to enable access into Pseudomonas, we further reduce side chain and further decrease size of penicillin. And this modified penicillin molecule is now known as Anti-Pseudomonal Penicillin. This Anti-Pseudomonal Penicillin constitute two groups of penicillin. One is carboxypenicillin and another is uridopenicillin. Carboxypenicillin include carbanicillin and ticarcillin. Uridopenicillin include piperacillin, azlocillin and meslocillin. Since there is minimal side chain in anti-pseudomonal penicillin, these antibiotics are maximum vulnerable to action of beta-lactamase enzyme. So these antibiotics are also given with beta-lactamase inhibitor. Ticarcillin is given with clavulanic acid, and this combination is available as timentin. Piperacillin is combined with tazobactam, and this combination is available as Josin or Piptage, along with enterococci and streptococci. These antibiotics cover Pseudomonas, Klebsiella, and anaerobes. For example, Bacteroides fragilis, Fusobacterium, and Prevotella species. Piptage is more effective against Pseudomonas and Klebsiella compared to ticarcillin. In recent time, there is increased resistance among gram-negative bacteria against piperacillin and ticarcillin. Gram-negative organisms resistant to this antibiotic are treated with carbapenem. Now let's see use and side effect of penicillin. We have already discussed penicillin G is drug of choice for syphilis. It is also used for treatment of leptospira, actinomyces, meningococcus infection, and anthrax. Ciprofloxacin is first-line drug to treat anthrax. Anti-staphylococcal antibiotic like nafcillin, oxacillin, dicloxacillin, cloxacillin are used in treatment of Staphylococcus aureus infection like skin and soft tissue infection. and pneumonia produced by methicillin-sensitive Staphylococcus aureus. Since amoxicillin cover pneumococcus, amoxicillin can be used in treatment of community-acquired pneumonia where culprit is Streptococcus pneumoniae. Amoxicillin is absorbed well from GIT, so it is good for bloodstream infection, but poor for GIT infection, while ampicillin is poorly absorbed from GIT, which make it good choice for GI infection. Ampicillin is drug of choice for meningitis produced by Listeria monocytogen and UTI caused by Enterococcus faecalis. Anti-Pseudomonal Penicillin, due to its coverage, can be used in community-acquired pneumonia, healthcare-associated pneumonia if pneumonia is caused by sensitive organism, and sepsis. Penicillin are not lipid-soluble drugs. That's why they cannot cross cell membrane and cannot kill intracellular organism like Chlamydia, Brucella, Legionella, and Mycobacterium tuberculosis. Intracellular organisms are killed by fluoroquinolones. So we use fluoroquinolones in this condition. Penicillin do not cross blood-brain barrier. But in case of meningeal inflammation due to shrinkage of endothelial cell, penicillin can cross it, but when patient condition improve and permeability of blood-brain barrier is restored, entry of penicillin in blood-brain barrier is prohibited. Just like blood-brain barrier, normal bone do not allow entry of penicillin, but in case of inflammation, allow entry of penicillin. We should not give bacteriostatic drug along with penicillin since penicillin acts against rapidly growing bacteria. So bacteriostatic drug decrease efficiency of penicillin. Combination of penicillin with aminoglycoside produce synergism. Since penicillin inhibits cell wall synthesis, which facilitate entry of aminoglycoside inside cytoplasm of microorganism, where it inhibits protein synthesis. Penicillin are very safe drug. Generally, they do not produce any side effect, but in rare instances, they can produce hypersensitivity reaction. Penicillin produce all three types of hypersensitivity reaction, type 1, type 2, and type 3. Penicillin do not produce type 4 hypersensitivity reaction. Type 1 hypersensitivity is IgE mediated. In type 2 hypersensitivity, antibody is formed against fixed antigen. While in type 3 hypersensitivity, there is circulating immune complex of antigen antibody, which can deposit in any tissue and produce damage. Most dangerous type of hypersensitivity reaction is anaphylactic shock, which is life-threatening emergency. Fortunately, it is very rare. Type 2 hypersensitivity reaction produce autoimmune hemolytic anemia when antibody are directed against antigen on RBC. They produce immune-mediated destruction of RBC, resulting in hemolytic anemia. When circulating immune complex deposit in blood vessel, they can cause vasculitis, which is present as skin ulcer. This immune complex can deposit in nephron, and these patients present as hematuria and proteinuria. Deposition of circulating complex in synovial membrane cause arthritis. In case of type 1 hypersensitivity, there is partial cross allergy with cephalosporin. In contrast to type 1, type 2 and type 3 do not exhibit cross allergy with cephalosporin. So we can give cephalosporin in this patient. Just like any broad spectrum antibiotic, amoxi, MP and anti-pseudomonal penicillin also destroy normal gut flora and produce diarrhea. Maximum broad spectrum antibiotic damage normal gut flora, but they are unable to kill C. diff. So facilitate growth of C. diff, giving rise to pseudomembranous colitis. Pseudomembrane is formed due to damage of GI mucosa protein-rich fluid spread over damaged GI mucosa and form membrane, which is known as pseudomembrane. Other side effects of penicillin are seizure, nephritis, and increased bleeding tendency due to dysfunction of platelet receptor. In recent time, there is increased resistance to penicillin among microorganisms. Resistance can be natural and can be acquired. Example of natural resistance in case of penicillin is bacteria which lack peptidoglycan cell wall like mycoplasma. So penicillin group of antibiotic do not work against mycoplasma since mycoplasma lack cell wall. Similarly, Mycobacterium tuberculosis do not contain peptidoglycan. Instead, they contain mycolic acid. So penicillin is ineffective against Mycobacterium tuberculosis. As we discussed, penicillin is not lipid soluble, so it cannot cross cell membrane and cannot kill intracellular organism like chlamydia. Chlamydia is leading cause of female infertility and leading infective cause of blindness. Resistance is acquired by production of beta-lactamase enzyme. Beta-lactamase is large family of enzyme. Against penicillin, these are known as penicillinase. When these are produced against cephalosporin, they are known as cephalosporinase. And beta-lactamase acting against carbapenem are known as carbapenemase. Since enzyme is a protein and protein is formed from translation of gene or DNA, so production of beta-lactamase is either mediated by chromosome or plasmid. Plasmid-mediated cross-resistance is more dangerous to community because bacteria can transfer resistance mechanism to non-resistant bacteria with help of conjugation. In gram-positive bacteria, penicillin which is produced is diffused into surrounding environment. That's why it can intercept penicillin molecule even when it is far away from bacteria. In case of gram-negative bacteria, penicillinase is concentrated into periplasmic space. So it cannot destroy penicillin molecule when it is away from bacteria. But when penicillin molecule enter into periplasmic space, it is exposed to increased concentration of beta-lactamase enzyme and destroyed. Second mechanism of acquired resistance is alteration of penicillin binding protein site. So antibiotic is unable to bind to target site and unable to exert its action. Example is MRSA and VRSA. Third mechanism is point mutation in gene encoding for porine channel and make porine channel more tight, which do not allow entry of antibiotic molecule inside the cell. Fourth mechanism of resistance is development of efflux pump. This mechanism is rare in case of penicillin. That's all for today's lecture. In next lecture, we will discuss about cephalosporin.